precaution, patients can't leave the room, so we're going to do a portable. They're in a negative pressure room, and you want to make sure that you have an N95 mask because it has a special filter in it to prevent inhalation of any airborne bacteria. And make sure your nose clips. Mrs. Monks, we're here for your x-ray.
The most important thing when dealing with the droplet precaution is to make sure you have a mask on before you enter the patient's room. Once you've entered the room, place a mask on your patient and then you can remove yours for the transport. Hi, Mrs. Influenza. My name is Taylor. I'm going to take you down for your chest x-ray. I'm going to ask that you put this on before we transport.
The patient I am seeing today is under contact precautions. When a patient is under contact precautions, you must wear gloves and a gown before entering their room. These are usually located right outside their door. Hello, Mrs. Cediff. My name is Nicole and I'll be taking your x-ray today. When you've entered the room of a patient that is under contact precautions and you have two techs with you, you generally have a clean tech and a dirty tech. The clean tech is the tech that takes the exposure and deals with the cassette, whereas the dirty tech has all contact with the patient, deals with positioning, etc. When you are done performing your x-ray and you're about ready to exit the room, you need to take off your PPE and throw it in the garbage can. To do that, you take your gloves off first by pinching the glove, the first one, and removing it, taking your clean hand and putting it inside the dirty glove and removing that. When removing the gown, you want to flip it over your head, slide it down your arms as not to touch the outside of the material.